my case scenario, I have a patient who is a 54-year-old male. He leads a pretty healthy lifestyle. He likes to bicycle daily. He does not smoke or do any drugs and only drinks wine occasionally. The reason he is at the doctor is he complains of dizziness, a headache, and a ringing sensation in the right ear. The symptoms started approximately 3 weeks ago, but he has gotten worse. The dizziness is starting to cause him difficulty with keeping his balance. The patient had been diagnosed with classical migraines around 10 years ago. He also experienced a head injury when he was in high school. This injury resulted in a concussion. There has been no lingering symptoms since. His family history is his mother died at 84 from pancreatic cancer, and his father died at 97 from cardiac arrest. The patient feels generally well except for symptoms described. He denies fever or chills or night sweats and weight loss. There is, however, unsteadiness when he walks. Medical terms that I chose to analyze are pancreatic, extraocular, and labyrinthitis. Pancreatic is pertaining to the pancreas. Extraocular pertains to the outside of the eye, most often referred to the muscles that control eye movement. Labyrinthitis is inflammation of the inner ear, often causing vertigo, dizziness, and balance issues. The common medical abbreviations that I chose are HEENT, which stands for head, eyes, ears, nose, throat, BP, which means blood pressure, and MIR, which is an abbreviation for magnetic resonance imaging. So currently, Meniere's disease is the most likely diagnosis. Currently Meniere's disease is the most likely diagnosis. This is a disorder of the inner ear that causes severe dizziness, like vertigo, ringing in the ear, tinnitus, hearing loss, and a feeling of fullness or congestion in the ear. Meniere's disease usually affects only one ear. This diagnosis seems most accurate for this patient. The cause of Meniere's disease remains unclear, but the symptoms are associated with a fluid imbalance in part of the inner ear called the labyrinth. So a solid understanding of medical terminology is crucial in healthcare settings. A solid understanding of medical terminology ensures healthcare professionals can communicate accurately and quickly. Knowing and using these terms help to reduce the risk of misunderstanding. It's important when diagnosing and coordinating care for patients. Using medical terminology also promotes informed consent for the patients because they understand what is happening to their bodies. This is an educational principle helping patients make an informed decision.